Let's talk about something that affects millions of parents every single night: sleep training. Or, more specifically, all the myths and misconceptions about sleep training that are keeping you awake when you don't need to be. If you're a new parent scrolling through parenting forums at 3 in the morning, you've probably encountered an overwhelming amount of conflicting advice. One expert says you must sleep train at exactly 4 months. Another says sleep training is cruel and damages your baby forever. Someone else insists their method is the only one that works. And meanwhile, you're just sitting there, exhausted, wondering what the truth actually is. So today, we're going to break down the most common sleep training myths that keep parents unnecessarily exhausted, anxious, and confused. We're going to look at what the actual research says and what might actually help you get some rest. Let's start with probably the biggest, most emotionally charged myth out there: that sleep training harms your baby's attachment or causes psychological damage. This one really gets parents worked up, and understandably so. No parent wants to do something that might hurt their child. The myth usually goes something like this: if you let your baby cry, even for a few minutes, you're breaking their trust and setting them up for attachment issues later in life. Here's what the research actually shows. There is no evidence that sleep training causes any long-term harm to children. Multiple studies have followed children who were sleep trained and compared them to children who weren't, and they found no differences in emotional health, attachment security, or behavioral problems. One major study from Australia followed over 200 families for 5 years. Some used sleep training methods, some didn't. The researchers found no difference whatsoever in the children's emotional or behavioral outcomes. Does this mean every parent must sleep train? Absolutely not. But it does mean that if you choose to sleep train, you don't need to feel guilty about it. Sleep training, when done appropriately, is about teaching a skill. Sleep is actually a learned skill for babies. You're not abandoning your baby, you're teaching them something valuable. Which brings us to myth number 2: that babies will naturally learn to sleep on their own without any intervention, so sleep training is unnecessary. Yes, most children do eventually sleep through the night, with or without formal sleep training. But here's what this myth ignores: the toll that months or years of severe sleep deprivation takes on parents. Sleep deprivation isn't just uncomfortable, it's actually dangerous. Studies show that parents of babies who don't sleep well have significantly higher rates of postpartum depression and anxiety. Sleep deprivation impairs your cognitive function as much as being legally drunk. It affects your patience, your decision-making, and your emotional regulation. So yes, your baby will eventually learn to sleep, but waiting years for that to happen naturally when you could teach them the skill sooner isn't noble. It's just hard on everyone, including your baby, who benefits from having well-rested, emotionally regulated parents. Myth number 3: you have to let your baby cry it out for hours, and there's no other way to sleep train. This myth causes a lot of parents to avoid sleep training entirely. But cry it out is just one approach to sleep training, and it's actually not the most commonly recommended one anymore. There's the Ferber method with gradually increasing check-ins. There's the chair method, where you slowly move further from the crib. There's pick up, put down. There are fading methods where you gradually reduce how much help you give. All of these methods have evidence showing they work. Most babies, when sleep trained with these gentler methods, cry for maybe 15 to 20 minutes at first, and that time decreases rapidly over just a few nights. Some crying during sleep training is normal and expected. Crying is how babies communicate frustration. When you're teaching your baby a new skill that involves changing a habit, they're going to protest. That doesn't mean they're traumatized. Myth number 4: you must sleep train at exactly 4 months, or you've missed your window. The 4-month mark gets attention because that's when babies go through a significant sleep regression. But the truth is, you can sleep train at many different ages. Some experts suggest waiting until 6 months. Some families sleep train even later. There's no single perfect window. What matters is that your baby is developmentally ready, that you're ready as a parent, and that your family actually needs the intervention. The best time to sleep train is when you're ready, your baby is healthy, and your family needs it. not when some arbitrary rule says you should. Myth number 5. Sleep training means you can never help your baby sleep again, or you'll ruin all your progress. This simply isn't true. Sleep training establishes a skill and a foundation, but it doesn't mean you become a robot who never responds to your child's needs. If your baby is sick, absolutely comfort them. If you're traveling, do what you need to do. If there's a sleep regression and they need extra reassurance, give it to them. You can return to normal sleep routines once the disruption passes. You might have 1 or 2 rough nights as they readjust, but you won't have to do the full sleep training process over again. Myth number 6. If sleep training doesn't work in 3 days, your baby is just not capable of sleeping well. Most sleep training methods take about 3 days to a week to show significant improvement, but some babies take longer. 2 weeks is not unusual. Sleep training also isn't magic. It won't fix sleep if the underlying problem isn't actually about sleep skills. If your baby's room is too bright, too hot, or their schedule is inappropriate for their age, sleep training won't fix that. Successful sleep training requires the right conditions, an appropriate schedule, a good sleep environment, a consistent bedtime routine, and a baby who is developmentally ready. Myth number 7. You shouldn't sleep train if you're breastfeeding, or sleep training will tank your milk supply. By 6 months, most babies don't actually need calories overnight from a nutritional standpoint. Many breastfeeding parents successfully sleep train by continuing to feed before bed and upon waking, but eliminating the every 2 hours snacking that's more about sleep association than hunger. If you're concerned about supply, you can pump once before bed. Most parents find that their supply adjusts just fine, especially if baby is eating more during the day. Sleep training and breastfeeding are not mutually exclusive. Myth number 8. Sleep training only works if you follow one specific method perfectly, with no modifications. Sleep training isn't a rigid formula where one wrong step ruins everything. It's a flexible set of principles. Put your baby down awake, let them fall asleep independently, stay consistent, and give it time. How you apply these principles can vary. The final myth is that sleep training is either for everyone or no one. It's just a tool. Some families don't need it, and some parents are fine with frequent night waking, and that's okay. But for families who are struggling, sleep training can be life-changing. There's no moral high ground. You're not a better parent for avoiding it, and you're not lazy for using it. Done properly, sleep training is safe, works at different ages, allows occasional help, and can teach healthy sleep skills. Make your choice based on your real situation, your family's well-being, and your mental health matter. You deserve rest.